Well, hello everybody. I'm going to give some time. I have my UNSC rollout to do with the elders of the UN. Mary Robinson, I'm gonna get to that after this, and then I'm gonna go to bed. I'm happy I've gotten rid of a lot of people. I've gotten rid of a lot. It's good, not enough yet. Still more to go. Still more to go, as I'm not going to do this narrative going forward with the PCC. I'm sorry, stats are in on vaccinations, world data, plus now my home province with an incredible experiment, a huge gamble by a high school graduate, a great talker, a circler of the truth, always lying, professional liar, Jason Kenney, who has now cost many lives in my home province. And stats, all Alberta stats in, the same stats many anti-vaxxers have used right here in Canada, especially in my home province, Alberta, who has a tremendously large support for that. And I've always been about freedoms. I've always been about everything. I myself have been double vaccinated, believe in vaccine choice. I've never cared until the numbers, which I always go with. The numbers are in. And it is clear the experiment done by Jason Kenney in Alberta has proven beyond any reasonable doubt that not only is COVID real, it's devastating. And we see it with the unvaccinated. And people are still trying to lie and deny with Alberta healthcare card registered data. I can't dispel it. I can't find any data to offset it. It is real. It's legit. And if anything I'm going to say is that anything I didn't know before, because the data wasn't available, I sure know now. And it has led me to go with the data as I always do. And people don't like it. And that's good, because the second I start lying, everybody with PCC, the second as a leader I start lying or going with narratives that are completely false, nut job kind of things that are proven false, clearly false. It's the end of the line. It's the end of the line of this party. You're going to watch PCC Maxime Bernier and his party crumble in the radical narrative that is completely now false. Real data right here in Canada, in the province of Alberta, when an autocratic premier runs solely on what they're going to decide and do, they do that, and the data comes in, and there's no getting out of it. And before we get into this, everybody, I want you to understand something about how Canada runs. It's for everybody worldwide, doesn't matter. Canada runs purely crown colonial, autocratically in every province and territory in this country. There are zero rules of governance, zero rules of how to govern, and absolutely no accountability whatsoever. In Canada, in our system that only 16 other countries are similar in today, in all UN nations of this world, 205 nations, but 193 in the UN. Only 16 operate like Canada. And regionally, Canada, zero constitutions since its inception. Called for in the Federal Constitution of Canada, 1867. But every elected premier has decided that because the Constitution says they are gods of men and women, actually gods of men, and women weren't even factored in, and that all Canadians are to be in a class structure system, that these gods among men are that first class citizen. Everybody else is second and third class, second class being the merchant, the business owner. They get some powers handed over from that first class in the regional system of governance. Again, No constitutions whatsoever. None whatsoever. Even though the Federal Constitution of Canada clearly divides powers to the provinces and territories and tells them you should make a constitution, enshrine this stuff, even though ours is very limited federally. In fact, we can use the crown to take away all democracy anyway. Now, if you guys don't do anything about it and don't give any power to the people and you enjoy the first class, we are going to make sure you're taken care of. Now, when you have groups and organizations grow in the civil society or of the people, you can hand off small pieces of your crown, pay them off, and then they'll work for the crown. That's how Canada works. The undemocratic absolute autocracy that destroys any and all real human rights available in this world since World War II. Now we're going to get into vaccines. Canada is a totally different animal. None of you look at the fact you can't trust doctors for several reasons. The biggest one, which I published 3 years ago now. Nobody's done as much work on this in Canada as myself, and I did that under Alberta independence when I ran in 2019. Canadian Medical Association, the wealthiest organization in Canada. Membership is all Canadian doctors who practice. There's no liability for doctors in Canada. No liability except for criminal code. That's it. So unless they've raped you and you can prove it under their care or other heinous crimes that are in the criminal code, absolutely, as far as their jobs are concerned, they are practicing in Canada, meaning there's no liability here, none whatsoever. They can screw up tremendously bad, be extremely incompetent, and there's absolutely nothing any Canadian from the second and third class can do about it. Zero. And they are among the wealthiest organization in all of Canada. Extremely wealthy. Okay? Besides maybe the small group of justices in your municipal, provincial, and federal courts. But as an organization, the Canadian Medical Association is tremendously wealthy. Wealth beyond measure. Wealth beyond measure. They're quite the special interest group with zero liability. Sure, they have ethics, they have all kinds of things, but again, it's all in with the criminal code. So in their work and their practice, which Canada it's practicing, meaning you're not really doing a job because you're not liable for the outcome of your job. You make a major mistake or a huge screw up, or you cost somebody their life because you failed to do your job properly, incompetence, there is zero recourse for that. Much the same as the politicians. A piece of the crown traded off. There's all kinds. We can get into unions, and I will be doing that throughout my political party. But today, it's all about vaccines, COVID-19, and I think we've let this roll now, and I want to hear from all of you, and we're going to go into real answers. Question A, you ask me whatever you like, and I'll scroll down, and we're going to get into it. Because I'm not changing my stance. This party's got to go forward, and I'm not interested in any more crazy. Because that will not get me anything. Won't get us anywhere, and I'd be failing everybody. So far, it's just a lot of people watching, but where are all the really strong question and answer people? Let's see. They're really good at popping. Oh, I've asked you lots of questions. Well, here I am live. Let me answer it because I'm not going to spend 6 days typing on a computer for all the nut jobs. So I want these questions now so I can answer them quickly in one forum. Okay, here we go. Not all of us are anti-vaxxers. Some... Oh. Okay, hold on. A lot of people. Okay. Kenny, okay, Nadine, Kenny's caucus is after him to resign, step down, and Chandro's been replaced. Nuts out in Alberta here. Oh, I know, Nadine, I know. And that's what a whole pile of people don't understand. Numbers and stats are in. Jason Kenney knew This was a runaway for weeks and weeks. In fact, he was in Europe. He put the government in auto mode. NDP talks about this Maclean's magazine, and they failed to address the fact that the premier runs absolutely autocratically the entire province. It was no different from any of the other premiers before, Jason. It's no different. It's crown colonial puritocracy, zero rules of governance, zero how to govern. We are nothing like the United States of America, everybody. But I really do want to hear things on COVID-19 here. Let's see here. For some reason, this scrolls to the top. Okay, no, yeah, some of us appreciate. Okay. Major says, no, all of us are anti-vaxxers. Some actually cannot take the jab. I really don't appreciate being called an anti-vaxxer by you and others. But again, I know enough to stay home if sick. That's great, Majorie. But here's the problem. Here's the problem. And everybody pay attention to this. Here's the problem. It's not about you and your responsibility. Here's the problem. There's a pile of people, and I was one of them, everybody. July 1st, I fly home to Alberta to be with my girls. Do you know what I do for 2 days? Go to the world's busiest indoor mall. No mask. I tell my girls, don't wear a mask. Don't wear a mask. I got one shot under me, one vaccine shot. My girls had one shot, my daughters. We spend the whole day out and about in the mall. Next day, the same thing. We're at the water park. Everyone's running up and down stairs. Lined up, lineups long. Everybody knowing distancing, nothing. Nobody got sick that we know of. Nobody got sick. Nobody got sick. A vast amount of the population will mull right through COVID-19 like nothing. But this is the problem. There are those who are susceptible at a much larger rate. Now, according to stats, Alberta proves it. They're much more susceptible. So they get sick, like a normal cough, cold, and within days, they need to be on a ventilator and in an ICU. At about a massive more rate than any influenza in the history, which is the flu. You can't say COVID's not real. I'm just telling you, everybody, COVID's very real. Jason Kennaway took away masks. He took away all distancing. I know I participated in it. I'm going back to Edmonton under harsh extremes, but I'm double vaxxed. So I guess I get a vaccine passport, even though Jason says there isn't one. All he did when he watched the numbers astronomically climb, and if anyone from Alberta's watching this, maybe you can help the rest of these Canadians here. Wild Rose. I was in the Wild Rose party. Extreme right, according to the rest of Canada. I liked that party. I was fundamental in it. I really enjoyed Brian Jean. Wild Rose, really religious folks, it's that right conservative, a harder right than the UCP and, Aaron O'Toole's CPC. A very hard, more conservative province, Alberta. They did a story on 660. They even had Maclean's on there, but they won't give up the crown. They go into all this and what Jason didn't tell any of you for weeks. I didn't look at it. I'm working on federal. I'm in Ontario. I just did a 3-province tour. I didn't look at any of the stats for Alberta. The last time I looked was the first week of July. ICU's record low. Infection rates record low. We go, okay, we beat this thing. Oh, that's what I think too. But the government data started coming in, and Jason knew, and the UCP caucus knew, and they kept pushing that, don't worry, vaccine rates will go up, even though numbers were going up astronomically, even though all the experts told them, don't do this, yada, yada, yada. Now our ICUs are overrun, to the likes of which no influenza has ever shown in any Canadian history in anywhere else. And because it's COVID-19, to prove it's real, the rest of the provinces were under harsh restrictions. They didn't hit the 4th wave. They all went like this through it, and little hiccup. But Alberta went whoop from July 1st at an incredible rate. that we can't just walk away from now. They've canceled thousands of surgeries. As the infection rates spread out, they had to close surgical rooms. Well, why do they do that? ICU, everybody, is generally a place you go when you're dying. You have minutes to live. You can't breathe, you're not conscious, you got blood coming out of your head, or you're full of bullet holes, or you've had a massive heart attack or a serious stroke and you're lying on the floor and you're going to die in minutes. Or you've had a major accident. There's all kinds of things. All kinds of things happens every day of the week. Or you're a stage of cancer that's past the point. You end up in ICU. Like, for example, a good friend of mine's father had colon cancer. And part of colon cancer goes to have a bowel movement in the middle of the night, and he fills the toilet bowl up with blood. Within minutes, he's on the floor. His son's calling 911. He's rushed to ICU because he bled out of his anus. Colon cancer. Had happened to him twice before he died in a stage of cancer that they couldn't treat. Now, when surgeries are canceled because you need life support rooms, that's available in surgery rooms. And when people with the flu are overwhelming an ICU that's never happened in record numbers, that no influenza can explain, it's COVID-19. We already know the virus was isolated. I know that person, Volker Gertz, Dr. Volker Gertz, not only a doctor, a virologist, but an excellent vaccine isolator in Canada here, out west Saskatchewan, University of Saskatchewan. Also, he's all into the animals because he is a veterinarian as well too. So not only a virologist, a veterinarian, he isolated COVID, first one of in Canada, and he was doing animal testing. He wanted to move on to human trials to manufacture Canada's vaccine. Justin Trudeau and the government defunded him, sent it all to Montreal, where you'll find that Quebec gets all the drugs and all manufacturing of any treatments. They always get it, no matter who did the work or whatever. But I published that a long time ago. The virus is real. It's isolated. It's been done right here in Canada by some tremendously talented people. It was backed up by the CDC back in early 2020 when I started to look at this seriously as COVID first became major in Canada. And I was told, your expert in Canada is Dr. Volker Gertz by the Trump administration. That's a fact. That was the best they had for Canada if you're Canadian. And I went to him. He even answered my questions. I even published his email, told me everything, answered a pile of questions a very long time ago. So I knew COVID was real. I didn't know the extent of it. I questioned that myself, as you've all seen. But now, Alberta stats show clearly to all Canadians what happens when you have a low vaccine rate. And then you see the victims and people publishing, oh no, this other country. I don't care about other countries. I care about data from Canada because we've been using all the data from Canada. Even anti-vaxxers sure love to use the data from John Carpe that didn't have vaccines because vaccines were not rolled out yet. He gave you every province with the same statistical analysis I'm giving to all of you now. The real stats. And people still don't want to accept it. And then they're going to still perpetuate lies. They're going to say all these things that has just been dispelled and disproven by my home province, Alberta. And I want to just go into this a little bit too, people. So the Canadian Criminal Code, which I published for all of you too, the third-class citizen, meaning all those people who work in hospitals, when you first walk into a hospital emergency, whatever your emergency is, you go up to the window, you register yourself, you got to provide your health care number, your name. They are all ready. What's your concern? They're entering into the computer. You are now part of vital statistics. What happens to you in that hospital care all the way until you die, every time you go there, whatever that is in your life, It's all recorded. It's all part of vital statistics. If a hospital person, now hear me out everybody, do you think thousands and thousands of healthcare workers and administrators are going to keep this big secret about smudging numbers, breaching the criminal code, where they're liable, not the politicians? They're liable. We just watched Chandro get thrown under the bus. Everybody hates him anyway, but Jason thinks that'll save him for his autocratic reigning hellfire on Alberta in economics, now in health, keeping secrets from Albertans, helping to perpetuate lies, and in the end, the data's there. I have the data, just as I had John's. Now we have the vaccine data and the rates, the ICU, all of it. We have it all. And this ain't going away. It's not going away. Thousands of Canadians with the surgeries put off. Hundreds and hundreds are going to die just over these 2 weeks. There's already hundreds of people dying. I have a good friend of mine on my Facebook, went through cancer. He lost his nose. In fact, the COVID, it should have never probably happened. The guy had it hell because of COVID-19, put off surgeries, put off treatments, and then he lost his entire nose. You don't even want to know the suffering that's been associated with this. And now the numbers in the ICU, everybody keeps saying to me, oh, but ICUs are always maxed out, Dave. Always, always, always. Yeah, of course. Because there's car accidents, there's a whole list. You've seen that list, and then COVID's in addition to that list. But now in Alberta, COVID became this in the list. That's what happened in July. Nobody can dispel this, I'm telling you all. You don't have to take my word for it. It's published, it's credible, it's there, and many, many world governments can be looking at this. The left, NDP, are going to capitalize on this, like no doubt. Alberta will likely flip to NDP. It is a absolute driving wedge, the last wedge in Jason Kenney's political career. He's not going to get out of this. I can't even get anybody out of this. It's why I can't move any more forward with any narrative of anti-vaccine or anti-this or anti-that. The numbers from Alberta and against the rest of Canada, who had all these things in place, higher vaccine rates. Jason opened up at a 38.3% vaccine double dose rate, meaning 62% of Albertans had either no vaccine or just looking at getting their first. And fully open, no masks, everything else. They never got their rate higher than the rest of Canada. Yes, Canada overall is 70%. Alberta was well below that. For double vaccination, well below. The deaths recorded in the hospital, largely 22 of them, all unvaxxed. Then there's one vaccination, or just like COVID-19 era. Remember those stats all the anti-vaxxers were running with? That, oh, well, yeah, they had COVID, but they were going to die of another disease. That's the stats. Past the 22, I only produce the unvaccinated stats with no complications, except for maybe their age. The others are complications because it's actually 29 in that period. But I just stay with 22 because that's who was unvaxxed, the largest bulk of it. Then there's people who had COVID on respirators with other major complications. And then there's those with one vax. I think two out of 22. When you do the math and add all that together, guess what? An efficacy for Pfizer of 94%, meaning, what do you want me to say? I'm sorry. Those are the numbers. I don't smudge them. You can't tell me that thousands of administration staff in Alberta are smudging numbers because they'll go to jail if they get caught. And when somebody does a criminal act like that, it's like, I'm going to tell you something about jail. Somebody commits a murder and they tell one or two people, you're finished. Or you steal something, you tell one or two people, you're finished. You're going to get caught. You've already sealed your fate. So if you're going to try and tell me that thousands of administration staff in Alberta, average Joe Janes who work for the government in healthcare, are going to work for the government and keep a secret and smudge stats, how many people are going to either rat themselves out because they feel bad, or are going to turn around and somebody's going to rat them out because they don't like them. It's out of the realm of reality. It is. I'm sorry. It's totally out of the realm of reality. One or two, that doesn't explain the massive stats. It doesn't. Out of many, many ICUs, and many, many emergency admissions, where you can trace what happened with that particular healthcare card all the way through the process, including up to ICU. Their medical history's there. It's all there, as it's always been logged with Alberta Health Services. What do you say now? What do you all say now? Not much. Somebody says your voice is slowed down on live. I don't know. So am I a loser because I want to wait for 5 years of clinical trials? No, Curtis, this is about denying that there is a virus. This is also about those who are sharing all kinds of fake stats like VAERS, video after video from Rumble, and all these things that are completely false. Curtis, you live in Alberta. You're a brother. The reality is, people died in Alberta over the last week that should have not died. And why? Because COVID-19 is overtaking the ICUs. Curtis, they've closed surgical rooms. I don't know how many people you've lost to cancer in your family. I've lost lots. I lost my best friend, stage 4, gone in 6 months. When you take away those treatments on a stage 1 or stage 2, prolong somebody 4 to 6 months on the number one killer, cancer, you're going to put them from a stage 1, 2 into a stage 3 and 4. And I don't know how many of you have dealt with late stage 3 or 4, but it's a 1 in 100 that they're going to make it through. And 99% of the time they're gone in 6 months. Gone in 6 months. Or they're going to lose something precious. Like a good friend of mine lost his nose because he couldn't get in when he should have been in earlier. They prolonged it. And that's just that. Another thing, everybody. Another thing when we talk about selfishness. So I'm not going to do this. I'm not going to do that. I'm not going to do this. I don't care what happens. Here's the thing. ICU is always filled. That's the design, right? There should be a percentage of occupancy to justify its extreme cost, right? Right? Shouldn't that be how you run a government? A responsible government? So when those numbers go and you don't have the capacity and it's random because it's COVID and they keep changing the rules and they change this, they change that, and Jason goes, just go do it. Everybody all hang out together, and he gives the number one experiment that backfires and ICUs get way overtaken. So I'm going to make it simple. A child drowning in the pool in the west end of Edmonton, Curtis, tries to go to the Royal Alec Hospital. And all of a sudden they say, I'm sorry, there's no ICU there. And they're trying to resuscitate them in the ambulance. And it's 8 minutes. Oh, you got to go across to the south side. 18 minutes later. The kid's brain dead, boom, died of drowning. Not COVID. They weren't weren't COVID positive. How many cases are we going to go through like that? How many? This has happened in history in Alberta before, but this particular several week period is going to disclose all that in just mere months. We're going to get all of those emergency service records of how many people in their area should have went to a particular hospital for that emergency care. They're dying. They have minutes to live, and there isn't a place for them there. So they get diverted to another unit. And that took more minutes because there is a set amount of minutes. A set amount of minutes for ICU people getting transported to ICU generally. And your ability to live beyond those minutes goes sharp nosedive down in the garbage. That's the reality of Alberta today. The reality is here, everybody. If you can't take a vaccine for any good reason, or in your religious right or whatever, or you just, hey, I'm going to wait, I'm not going to do that, I'm not going to participate, I don't care. As you watch numbers of COVID go up, I'm double vaxxed, nothing's happened to me. I got to go to work every day with a mask, got to go wherever I go with a mask because it's not enough. I get all kinds of restrictions placed on my livelihood, as are a majority of Canadians now. At some point, people get sick of it. They get sick of it. I don't control civil rights. The government does, your provincial governments do, and the federal and provincial governments with their crown run that. They run that. The cost of ICU in Alberta, I've run through the numbers, Curtis. So I know you're a conservative guy, you pay your bills, take care of your family, but why is the government not telling you that if we vaccinate at this rate, with the numbers we have right now, it's only going to cost the taxpayers this amount of hundreds of millions, 300 and some million dollars, if we get people to vaccinate at that. If we don't, ICU and everything else and lockdowns is going to cost 16 times more than that, in the billions. In the billions. I just went with ICU, but there's also all the restrictions, all the problems destroying us economically and many businesses, which I am not down with. Not down with. At what point do you say unvaccinated people, clearly, at least in Alberta's statistics, are way higher to end up in ICU at these tremendous costs, $2,500 a day, diverting it from other taxpayers who may follow in line and do whatever and want to end the lockdowns, just want to work, provide for their family. A workplace accident happens, guy gets hit from a workplace accident, they go to rush him to the hospital. Oh, sorry, can't come to this one, the ICU's filled, we have no surgery, it's a head injury. Oh shoot, our surgical rooms are overtaken with COVID patients. Send them another 8 minutes down there. Meanwhile, the brain injury is too severe, he's bleeding out, it's permanent, he's dead. What do they say? Oh, well, it was such an impact. But you know, if you had those 4 minutes, his chances of surviving were that much higher. This is the problem, everybody. This is what we face right now, and the data and numbers are in Alberta, of all places, my own province, something I know quite a bit about with the real stats. I can't ignore this, and I can't lie to all of you. This is reality. This is reality. It's a manufactured crisis, Jeremy says. Ivermectin or hydrochloroquine. Whoop. I already kind of think what that is, but deleted? No. Did he? I don't know what happened now. Let's see. Okay, I'm going to try this one here. That seems like me. Question. Should there be strict division between medical science and allowable government intervention in public health policy? I'm 70 and caring for my 93-year-old mother who's in good health. Oh, why is it doing this? I don't know why it's doing this. Let me see if that scrolls. Something's wrong with this, which is not normal. Unless these people just delete it. I don't think so. It shows you care. My mom received. Somebody's answering some. My father-in-law who resides in an old age home is of sound mind and body. But won't let me scroll back. Let's see here. I think for some reason they're putting new comments on top. According to a lawyer, Reiner Fulmick, are lying. Okay, so is Reimer Fulmick, is that the one who I think is from Germany or Switzerland? Right? Why are you guys going? I just got to ask this. Why are you not going with real statistics of your fellow countrymen registered in Canada? Why are we going with people? And I think Reimer Fulmick's another one who said ICJ, which Canada hasn't been a member of since 1994, which is wrong, but Canada quit that UN binding organ, and it's in a UN binding organ. It's in fact part of the 1945 charter. Canada quit it. So why would you guys, I gotta ask that, why do you go with some foreign lawyer in a foreign country, the foreign bar, who can't take any Canadian whatsoever to that court or do anything he says for any Canadian? Why? Why are you going there? Because you're looking for somebody to tell you what you want to hear. And then you donate to them too. A lot of you did. I know you did. It's sick. Somebody said something there about United Nations. United Nations. I don't know why it's scrolling up, but we're going to go down and see what happens. We're all waiting for your questions to be answered. Debbie Parnell. I don't know. We're all waiting for questions to be answered. Wouldn't that suggest our healthcare has been in crisis for many years? Yes, Cindy, it has been. And that's the thing, NDP, UCP, or anybody, our healthcare has always been in problems. But if we don't have the primary sector or the workforce, because that's your number one primary source of government revenue, the healthcare runs on tax dollars from primary sector workers. Whatever you pay into healthcare comes from the primary sector workforce, taxes, not companies, not great investments by your government. The number one source, besides borrowing against said taxpayers for the forever future, is the taxes you collect from that third class. Payroll taxes. If the payroll isn't up to snuff, you've got to cut back the services, meaning putting your health in crisis. We can't print money or borrow money to make our health care better. Let's see. Jeez, I thought this was Q&A. Okay, you better speak up about the hoax virus before you have no rights left. Michael, it's not a hoax virus. It's not a hoax. There has never been this kind of hospitalizations due to a flu. Influenza doesn't come anywhere close to what Alberta just experienced for 2 weeks. Not even close, not in your life. There's never been this many people through ICU for a flu ever in a September, ever. And it's only in Alberta, because why? Alberta was open, zero distance, zero anything, and they ignored the effects of COVID-19 at a 38.3% rate of vaccination. And largely unvaxxed are in the ICU, taking up bed spaces for everybody else, regardless of how crappy our healthcare system is these days, how underfunded it is. It's that much worse. Facts, not bullshit. It's right there in your stats by you Canadians, specifically Albertans, with an Alberta healthcare number. Easily traced, verified, it's not smudged. People went to the doctor, used their healthcare card, get logged in the system, end up in ICU. That's the truth. And I'm going to keep saying, not a hoax. Not 2020, 2019, that 1 year period, influenza. The entire 12 months can be capitulated into just 3 days in Alberta. There's never been a flu recorded in any Alberta history like that. And these people didn't die of heart attacks, they died of respiratory failure. An entire year's worth of a year before data on Alberta influenza in 3 days. Way beyond off the charts, everybody. You won't find any influenza statistics to compare to 3 days of Alberta this past week. 3 days of Alberta. I even know the numbers are higher. The day after, it went up even higher again. Something like 1,600 cases a day. No, not all ICU. 222 ICU. 22 deaths in 3 days. Look at the 2019, 2020 entire year stats of influenza. I think it's safe to say It ain't influenza. No hoax, guys. Renee says, do you or your doctor expert now? No, I don't need to be a doctor expert. I'm an economist who does statistical analysis. The same analysis you all accepted from John Carpe. An entire range of all provinces' data before the vaccine. Now the same data is presented to you saying, it's a lie, it's smudged. I want the data as it's told before vaccines. Same source, same data, but I don't like this data, so it's fake. Terrible. You're a disgusting human being. That's the answer. Lindsay Hill, actually, ma'am, not to defend Dave as he's dug his own hole. I don't have any hole. This is real data you all took. You all took it. You all took it with the Justice Center of Constitutional Freedoms, a good friend of mine, John Carpe. You all took it, swallowed it, sent it out there, and now the same data comes forward. You say, lies! Then that means everything you've been championing for a year is a lie. A lie. What? The data's good last year because it fit your narrative because there were no vaccines. No vaccines. But now that there's vaccines and the data damns you, the new data clearly damns you in all of Canada. Alberta's data damns all anti-vaxxers. Completely damns them straight to hell. That's what the data says. I can't make it up. Can't make it up. And the mainstream sees it. Anyone with an IQ over 125 sees it, except for people with horse blinders. It will be my narrative. I'm not wrong. I don't see it. I won't listen. Even though you used all that data, you sure propagated, you sent it out there. You loved the data when it suited your narrative. But the same data now shows you clearly, evidence-based, and now it's all manufactured. It's a lie. Alberta doesn't have all these problems. They don't need to be flying people to Ontario. It's fake. It's for fun. Canceling surgeries is fun. People dying's fun. No, I'm sorry. You don't get to do that. And then here we go. I know 3 people, my dad, my brother, my sister, Marilyn. I'm sorry. Bullshit, I call bullshit on you. I'm sorry, you're lying. I know hundreds, literally hundreds and hundreds. I watched live in the 50-minute wait time 2 times. I didn't go to the little vaccine clinic. I went to big public forum ones, hosted at mega centers. 1,000 people around me, even in Alberta. I didn't get it. They screwed me over so I wouldn't beat Trudeau. But for my second shot, I didn't get that one. But I watched as every 15 minutes, 1,000 more people vaccinated. Nobody wigging out, nobody falling down, everybody walking out of there. No seizures, no complications, no nothing. I know, literally, I'm working with people vaccinated in my workforce. Hundreds of them. No complications, not a one. Hundreds of them. Tons of friends and family double vaccinated. Some of us even months ahead of this. And guess what? 0 complications. No one died. The truth is, anybody dying, just like COVID-19, other condition or whatever, or age or other ailments, they were going to go anyway. Just as COVID-19 will take them anyway. I'm sorry. We don't live forever. We don't live forever. Okay, here's the other thing. So explain this to me, everybody. There has been billions of vaccinations worldwide. Where's all the massive death tolls? Where are they? The USA runs lawsuits. They have a vaccine injury site for compensation if you're a victim of vaccination injury. They even have historically all cases of vaccine injury from even Pfizer. They got them all. USA, you're allowed to sue, and you can prove your case, and they do class action lawsuits there. Canada, no, never, not in a million years. I always go to CDC, FDA, and I go through the court system of USA to find out about a drug. I always go there to find out about a drug because Canada won't ban it. They have to wait for US action before Canada will say, oh yeah, and they're usually late. And it doesn't matter if doctors are told not to prescribe and they're still doing it, and they get caught doing it years later, and they're getting paid to do that on a generic brand of the same drug that has all kinds of problems. All those lawsuits are there, all those settlements are there, and VAERS, everybody going to that VAERS, oh look, reported, unsubstantiated reports. How many anti-vaxxers going in there just typing away their bullshit? Oh, I know everybody died, I know my family, but you can't back it up when it comes time to disclose who, where, healthcare, blah, blah, blah. Oh, wait a minute. Oh, no. Well, I know a guy, I know a girl, or it was an aunt. Oh, maybe I made a mistake. And then they're scrubbed. That's what happens. VAERS is a joke. Anyone can report anything. I'm sure you can register it. But if you can't complete the personal information and verify it, it doesn't go on past that. You don't get to go through the stages. And very few do. Because people love to lie for their narratives. Politicians clearly do it, and so will all of you and a lot of you when it fits your narrative of what you want. You will tell any bullshit story, all kinds of radical crazy that can't be backed up. Can't be backed up. You won't have any doctor forums, you won't have any tests done. I've been tested for COVID-19 in just this year alone. Since January, I've been tested for COVID-19 more than a dozen times. Negative all the way through. People go, oh, fake PCR test. And I have met thousands and thousands of Canadians, traveled all over the place, and I've never gotten sick, never tested positive. And people tell me about fake PCR tests, fake this, fake. Oh no, it's a... They must work, because I've never, ever tested positive. I've never been sick, not since a horrendous flu 2 years ago, January. In fact, no influenza, no bronchitis. I smoke tremendously. Bronchitis is not uncommon for me, or other ailments or influenza in harsh seasons. I've been up to Fort McMurray since. I've been all over. A lot of you who followed me a long time have seen even my videos and the shit I got into up there. But the reality is, guess who hasn't been sick in 2 years? Distancing, washing your hands, everybody doing that. Maybe masking. I don't think a virus is so tiny it can pass through a mask. Does it might help? Maybe a little bit. You don't want people spitting in your eyes or in your mouth. How many people talking about blah, 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 and the spit's just flying out, and you even feel it hit your lips or in your mouth. You're like, gross, man. Everybody remember that? I haven't been sick since January of 2020. Not so much as a sore throat, not a cough, not, besides a little sneeze here and there, but nothing. No runny nose, no usual cold, no influenza for me, nothing. I'm a healthy guy. I wasn't scared of COVID-19. Definitely not scared of the vaccine. Hasn't done nothing to me. Nothing. Physically active, do all the normal stuff. Got my weight down on my own because I had to. My knees were going. I started having health problems with arthritis. I'm getting to that age. Let's see what else we got. So apathetic. You realize the numbers in hospitals have COVID. Let's see. I don't know why it's scrolling backwards. Let's go to the back here. Let's see. While my natural immunity was enough to stop me from getting COVID, my 4 families all had COVID, and we were around each other daily before and after. Yeah, Tabitha, that's what I mean. Some people are going to do well, but astronomically, like myself and other young people, actually the younger people even do better. That's a fact. Kid will get a little runny nose, but great-grandma or somebody who's immune compromised or severely overweight, obese, maybe type 2 from obesity or alcoholism or drug abusing or has a rundown immune system for other things in life or have other ailments, they're susceptible. A lot more susceptible than even influenza. Even influenza, that's clear. The numbers out of Alberta alone, when you remove everything and let everybody have a free-for-all, clearly prove from July till right now that Alberta was hit dramatically the hardest, harder than any other province by an incredibly large margin. Ontario, vastly more dense, vastly more populated, and dense in the cities, did not even have anywhere near Alberta's numbers, not by an extremely large margin. The tail of the tape is there, the numbers are in. You can't classify this as the typical flu. It's no longer that. Alberta has blown that right out of the water. One Jason Kenney. Even when the numbers were going up, he figured, well, if we can get to 50 or 60%, which they didn't even hit until just recently, lowest double vax numbers in all of Canada. That's true. Marina Ryder says, ask me, oh, okay, whatever. Debbie, interesting that the average age of death is 83, average age of death from COVID, 83. I don't know about that, Debbie. I don't know, and I don't care. What I care about is the fact that ICUs in Alberta were completely maxed out 1/3 by people with a flu that's called COVID-19. Never seen in any history, and everybody else from other conditions who need ICU couldn't get it. And they're ready to go triage. Not made up, not because Alberta's got all of a sudden a super crappy healthcare system, more crappier than it usually is. No, it's because too many people got a disease that overran the system. That disease is called COVID-19, and the stats are there official, not smudged. No stats are smudged, just as John Carpe's stats were not smudged all last year. Not even just Alberta, but every province and all factors. So this is why it's damning now. It's very damning because we have John's numbers of all those other ailments, and then we see an overrun ICU from a COVID runaway 19, and we see all those other diseases or ailments getting tossed to the side, just as John's numbers provide, because those are real statistics registered by every Albertan's health care card when they go in and are diagnosed in all these scenarios. You see the problem here yet, people? Folks? Did you just call it a flu? A flu called COVID? Yes, Douglas, I sure did. I guess influenza is not SARS-CoV, but those are the conditions that lead to it. For those who deny that COVID-19 isn't a real pandemic, those who believe it's just the flu, it's not just the flu. It's a super viral infection that now has statistics of vaxxed and not vaxxed and an overrun ICU. My phone, not me, I don't know. You act as if you answered my question. You didn't. I don't know, Debbie, what's your question? Let's let you roll it through because this isn't scrolling. I don't know what's going on, but it's taken away. I got Scott Hodder. How is it the homeless population seems to be okay? I don't know, Scott. What do you mean they're okay? I don't. Where's your stats on that? Show me the stats on homeless and COVID-19. Show me any province in all of Canada. Every province has the stats because healthcare is provincial. So homeless, if they don't have a healthcare card, maybe that's it. I don't know. I haven't even looked at any stats on who's black, who's white, who had COVID. All I know is the stats as they're laid out, as they've been looked at. I have no stats on immigration, which I wanted, but I can tell you what Alberta healthcare card stats are, and ages, birth dates, all that. That's all registered, you guys. Why do ICE units closed in some of the rural areas? Why do the ICUs close in some of the... Chantel asks, why are ICUs closed in some of the rural areas? I was born in Peace River, Alberta. The hospital I was born into, the old hospital, demo gone. Peace River, no hospital to that capacity. I mean, they have clinic and small unit, but nothing of the hospital I was born into. Cuts, rural gets cut. Here's another one for you. Red Deer, 2 ridings with a tremendous population. Big city here. How come? Because they only have 2 provincial weighted ridings did they get cut? They should have a cardiac unit. They don't. Why? Because they don't count. Rural has a small impact on your electability. So rural always gets cut. Same reason why do all rural with oil field have to pay all that extra tax now? Why do they get taxed on the wells? Why do they got to pay the carbon pricing? Why? Some people in some rural communities are going to see taxes of $2,000. Well, they did already this summer. And farmers who got bills of upwards of $34,000. Why do they do that? Because the vote doesn't matter. Because they won't get that politician elected. If the politician's going to abuse anybody or cut services to anybody, it's going to be those with the least amount of say over the election or impact on the election. Who can you let go to gain your majority or win government? That's the truth, as sad as that is. You're asking people to believe false positive spewing PCR test, really. Lindsay, instead of accusing me of, you're asking people to believe, I'm just telling you what is. And I'm telling you what the stats are from the province of Alberta, which should concern you as a Canadian, or if you're an Albertan, that should concern you. People died this week who should have never died. Many. And there are people, thousands, who are not getting surgeries for the foreseeable month or 2 months or 3 months. Then there's a rescheduling, 4 or 6 months. In the world of cancer, a stage 1 or 2, that's not a big deal right now. I mean, it could lead to that. There's going to be a pile of them who are stage 3, 4. Goodbye, you're already dead. And you likely wouldn't have died. You may have only gotten another 5 years, or maybe you would have had a full life. But the reality is now you're going to be gone in the next 6 months. That's a fact. COVID is a psyops. I disagree with your opinion about Alberta health numbers. Okay, my opinion, right? Health numbers are your stats. If you don't have stats, you don't have a society. And anyone who talks like that, this is the problem I have, Michael. People who say, you can't believe in stats, we shouldn't have stats. Stats can't be trusted. The government can't be trusted. All the workers who work for government go through a system, they report, they would have ratted it out. People would be talking about it. People would be coming forward going, I smudged the numbers. People don't do that. Generally, they don't. They don't like to do crimes of that nature. Lying about health statistics, entering data, making up healthcare numbers or fake people. Or that don't really happen, man. I'm sorry, it don't happen. It's delusional to think that happens. People who talk like that are actually destroying the society, because you can't have an economy, you can't have any health services, you can't have other public sector functions, you couldn't have mail, you couldn't count on your mail, you couldn't count on the internet to run, you couldn't count on your investments, your banking, or all these other things if you didn't have statistical analysis, census, and the rest of it. People talking like that, you might as well go back to the dark ages. Be a third world country, because there are countries that still run like that. They're all third world. You don't have any shoes. You live outside. We could do that, because you're not running a first class country without real consensus and statistical analysis. You don't have any real serious services or programs, education, all that. It wouldn't run. It wouldn't run. And it takes thousands and thousands of employees to run that. And it all runs on statistics. Otherwise, you wouldn't have a budget. You wouldn't be able to plan ahead for the future, your children, or make laws or make decisions. Nothing would happen. People would be living in a cave. I mean, there's still people out there that live that way, but not first-class societies. Anyone who says, oh, it's all smudged, it's fake, that's ludicrous. It really is. It's ludicrous. I've lived my entire life on statistics. I'm an economist. I'm sorry that no one is going to tell you that statistics are smudged and it's all garbage and it's all faked and all the government employees are running that. You guys got to listen to yourselves. You can't, I'm telling you, you can't get 3 people to hold a secret in life. You should all know this in your lives. You tell 1 or 2 people, everybody knows. Do you think people be smudging statistics, working $20 to $40 an hour, whatever their area of specialty is? Do you think they're going to keep those kind of secrets? Thousands of people? You can't get 1 or 2 people to keep a secret. How are you going to get thousands to go along with your secret plan? Think about it, everybody. It's real. It makes sense. Donald's a guy with 9 lives. You should be made news. These stats come from a branch of government. Government cannot... Okay. The stats come from your healthcare cards entered by everyday Joe Janes every time you go to the hospital. They can't be smudged. I don't know about other countries. I don't care. Unless it's FDA and CDC. That's all I ever cared about. Because I can trust them because they get sued. They have lawsuit programs, which I've already published for all of you. Check it out. And the real cases. You don't have any of that in Canada because it's practicing. COVID is man-made. Blah, blah, blah. Okay, so if it's man-made, where's your evidence and proof? I always do this. Where's your numbers? I don't want to hear about a secret CIA guy, a friend of mine, or a bitch shoot, or a YouTube video. Nobody likes that. It's crazy. It's not good. You have to have real proof. And nobody yet, as of this day, United States don't have any proof of that. We heard Donald Trump accused. And guess what he did in February? Are you listening to this? Donald Trump pulled his allegation from China. Pulled it officially. His administration and him did in February, right before he left government. A loose end he had to pull because he knew he wasn't going to be president anymore. Fact, not fiction. Let's see here. So now I'm going to try and go back. I think it's whenever somebody texts. Okay. Every time somebody types, it takes the... COVID's a psyops. Yeah, no good. Why do they think COVID-19 vaccinations is better than herd? Okay, why do they think that COVID-19 vaccination is better than herd immunity? Justin Savoy, this is a great question. This is a great question. Finally, something of serious substance. Viruses, mRNA vaccine, all the treatments, we can't get herd immunity from viruses. You can't. There's no cure for viruses. They live, they change, they mutate. They mutate faster than the human condition in a body. My body can never get to an immunity against a virus like SARS-CoV. You just can't. It affects us. You can't ever beat a virus. You can't. They transform change at the microscopic level faster than we evolve. Meaning the next time somebody's going to evolve an immunity to a virus could be my offspring. But my life, never get an immunity from COVID. Now, my immune system can fight it, learn from it. For so many months, I'll be good with that until the new variation of that soldier comes back to attack my body. My army learns a little bit, but the enemy's going to get stronger. My offspring, if I fought that virus long enough, maybe my offspring may have a better shot than me. It may take 10 generations before the human being's able to beat something like SARS-CoV, or like AIDS, never, unless they figure out drugs over a long period of time to suppress it. And that's what we're talking about. Or boosting your immune response by giving a weak, unreplicated version of that, we'll call it a computer image, or like a dog. I always say what an mRNA vaccination is. Here's what the real COVID is. It's a monster. It looks like an insect. But let's throw a toy one at the dog, so the dog learns to attack and rip that apart. And then when the real mouse, let's say it's a mouse, cat, you play with the toy cat and you get the mouse, go on with the cat. And when the real one comes, cat, just tear it apart, no problem. It's not like it's the first time I'd ever seen it. That's all it is, a booster, you guys. It's not 100% going to do you any kind of permanent immunity. Never gonna. It's a virus. We see in all kinds of plagues of bacterial nature, yes, we beat it. Or over thousands of years after massive populations for sometimes decades and decades die until we get a natural immunity, but it won't be in your lifetime. Your body will never make an immunity to this particular virus. You won't. And they come around every now and then, and they've wiped out human beings before. Sometimes it takes decades of generations. Sometimes it takes centuries. That's reality. Cleanliness helps. They know that. Sanitary facilities help. That's the truth. That's all there is. It's a booster. That's all they got right now. But it's effective to a degree. A lot better than not being vaccinated, as stats clearly show you just in the province of Alberta. When you don't have the vaccine rate, you see who died in ICU. And then the stats are there. We didn't have those stats before. Yeah, natural immunity if you survive COVID-19. And for a vast majority of us, we will get immunity. You will survive it. There's people who've lost their sense of smell. There's other variations of people bleeding their eyes. They've suffered other complications. Other complications are led to other problems. One woman couldn't walk anymore. There's some serious side effects of COVID-19 in its natural state, as it's new to our immune systems. You're going to have a percentage of the population that won't survive this, but it's what overruns our healthcare system when you let it run away through the population, that most people are going to make it through. But there is a large enough percentage to overrun our healthcare system, unlike anything before it for a very long time. This isn't the first disease to come our way. It won't be the last one. And it takes time. Those who survive it, who don't die, don't end up in ICU, will, for a period of several months, have a stronger immunity, maybe, than vaccinated people, because vaccinated people didn't get a replicating virus, the real one, that can replicate in your body and have to fight it really hard, a war, so to speak, a real one, for a long period of time. Yes, the immune system will be much, much stronger. I'm sure of that. I'm sure that makes sense. But at the reality, if you have the first little battle and your immune system learns how to fight that particular disease, it will recognize it before it can naturally replicate in your body, before your body can defeat it. That's what the booster is. So for those with a weakened immune system or have a problem taking on COVID, with the shots, possibly the booster, if you have other complications that they've learned of, will help you over an unvaccinated person who can't really fight the virus and will end up in ICU. That's the truth. Is it a small percentage of the population? Sure it is. But I can tell you right now, it's not all 83-year-olds in ICU. It's not. A variety of ranges. But either way, if a 20-year-old's driving his bike and he gets clipped in a car accident, smacks his head on the concrete, and the hospital's 8 minutes from him, or 6 minutes, or 4.5 minutes, but the ICU is taken up by all these COVID patients who weren't vaccinated. It's overrun, and he has to go 12, 13 more minutes away to another hospital, and he dies. Now what do you say? Because there's only limits to what we can do and pay for. And Alberta's in a terrible financial situation. Terrible. Combination of provincial and federal extremes of autocracy. Oh, there's something about manufacture there. I gotta re-scroll this. 80% women first trimester miscarriages. Yo, stop this bullshit narrative. I don't know what miscarriages and the rest are. Rocky TB, don't even use your real name. That one's gotta go. That's what I mean. So people can't use their real name. That's number one. You're full of shit. But you're saying 80% woman first trimester miscarriages. You stop this bullshit narrative. What does miscarriages have to do with the pandemic and the stats coming out of Alberta right now, and all the major problems in only Alberta right now in all of Canada? Rocky, why don't you answer that question for yourself instead of saying it's a bullshit narrative? Because it's very, very real in Alberta. And I just laugh. Everybody's like, no, it's not. It's not real. It's a conspiracy lie. And it's like, wow. The morgues, that's a lie too. The 2 morgues, that's a lie too. The backlog, that was all a lie. Again, billions of people vaccinated. I know tremendous amounts of people vaccinated. Not a hiccup, not a blurb, not nothing. But you guys all say, oh, it's going to kill you, it's going to do it. And then you going, oh, COVID's fake, and if you take the vaccine, ivermectin. But there is not one stat that you can publish to support anything you say. And now there's absolute stats in the opposite now. Now we have vaccine data in Alberta for all of Canada. And actually, it's going to be for all of the world, which is damning. It's damning for all the people like you who live in, I only care about the stats from the same source when it supports my position. But when it doesn't, it's fake, it's garbage, can't trust the government. But you trusted it to go with all your narratives over the last year. A lot of you did. Most of you did. You used those stats. But then now, we got stats the other way. Now we have vaccine. Oh, no. No, we don't. We got to make up new stuff now. Let's go into other countries. Forget that country. We only use our own country when it's for our narrative. But when the same stats show a different narrative, let's go somewhere else and get some BitChute or YouTube or people from radical places, countries you probably wouldn't even want to live in because they're so corrupt. Even worse in your country or in a third world state. You say, well, look, there's no stats there. Well, of course, there's also a lower life expectancy there. If you didn't die of COVID, you won't make it to 60 anyway. Pathetic. It's pathetic. I like that. It's bullshit. And it's like, but you come with nothing. Nobody comes with any credible stats. Anything that dispels the Alberta narrative. Just that you can't trust it. You only trust it when it tells you what I want it to say. Like last year with the Justice Center of Constitutional Freedoms. Same source, same stats, and you all loved it. You shared it, you all supported it, you all put it in meme. You go. But now the same source data with vaccines, and all of a sudden, nope, it's corrupted, it's wrong because it doesn't fit my narrative. This is a fringe sick group that I want off my Facebook. So we're going to go through that today. When I'm gone. Take down the crown, Dave. Yes, Bev, I will. AIDS is another hoax. Whoa, see everybody? Crazy. AIDS is a hoax. Okay. Shame on you, prick pushers. Genocide of babies in the womb, 80% Israel doctrine for satanic sacrifice. Rocky, you don't even make any sense. And what does miscarriages or I think you're talking abortion, what does that have to do with vaccinations? What does that have to do with, and how come no one in the billions of vaccines administered, nobody's dead? There's no spike from vaccines and death rates. In fact, it's showing the opposite. And everybody said, oh, I know somebody. But then you're not registered in the US. They're not even registered. Not even registered. And they have a way lower vaccine rate. China, 1/3 the vaccine rate. I think we are for doubled now. And Russia even lower than that. No, yeah. I used to like and respect you, Dave, but now you're just full of shit because ours was the same Mars and nobody had a vaccine for either the people lived, and you don't see it anymore. Sorry to burst your bubble. I'm telling you, Dan, the stats are in from Alberta, the same stats I've used for 2 years, as well as other Canadian stats, all the provinces, plus Canada-wide, same stats John used in his entire presentation over last year. I went through it with the microscope. I'm using the same stats today from the same sources. And now the stats show a different scenario that incorporates vaccines. And now it's garbage. It was good when the economic impacts and the mortality rate versus these other diseases, oh look, it only affects this portion of the population and a few from there, and it only gets less the younger you get, and 99 point blood can survive this, but there are some complications. Then we get into vaccine that eliminates all that, takes away the strain. We show that Alberta has strain, same statistics, and then now it can't be used. We can't use those because it doesn't fit your narrative. You know what this is, right? You're no different than your filthy, corrupt government of politicians who go to you for polls, tell you everything you want to hear, and they'll change whatever they say. They'll lie to you. I don't lie to you. They lie to you to get your vote, tell you what you want to hear, entertain your fictions, your fantasies, and you'll give them your vote. I don't do that. I'm sorry, I don't. And the real numbers are right in front of you right now. Same numbers you more than shared for a whole year. Same sources. Again, it's in front of you and you say, nope, this time it's bullshit. Last time was okay because it told me what I needed to hear, what I wanted to hear to fit my narrative that has now cost people their lives. That's a fact. That's a fact. And it's only going to get worse in the next few months as quarterlies and statistics come in and we compile them. We're going to get the data of those from 4 or 8 minute trips in an ambulance diverted for those 12 to 20 minute trips where we watch these people who are dying that if they go past the time, they're extremely likely to die. We're going to have all that and cancer and the rest of it exactly the same way John went through it. Now we're going to go through it the other way with the same stats, same sources with vaccines. And then, I know you're all, oh yeah, I don't want to hear it pounding your drums, but it was okay before there were vaccines because you needed to make sure everybody knew that COVID's not as bad as so many other things, even though clearly it's massively worse than any influenza ever in Alberta history, ever by an extremely large margin when left unchecked, when left to run away. Yeah, there it is again, Bob, too. Statistic based on a fraudulent mythology are wrong. In the ICU hospital from COVID with COVID or due to COVID. They're on respirators. You guys, you have to stop now. ICU. You don't walk into ICU. You don't go, doctor, I got a tummy ache. You can go to emergency like that, or I broke my leg, and you're talking, you're cognitive, you're not. You're shot 6 times. You go in for surgery, you end up in ICU. You're unconscious. You're getting blood transfusion. You're on sometimes life-saving machines holding you alive because you're not capable of living at that point. You're not. You're going to die unless a machine keeps you alive. That's ICU. Most people in ICU, a large majority, are absolutely unconscious and are on a machine that keeps them alive mechanically. That is ICU. Or they're in some situation where they can't move. They may be able to squeak out some words or talk, but something's been put into them keeping them alive, whether that's a fluid or a dialysis. Like, it just goes on. Something's getting circulated out. That's ICU. Most times it's people who aren't up and running, walking around, or even cognitive. And without that particular unit, with those machines and all their encompassing different systems, keeps them alive, or within minutes they're going to die. You unplug the machine, they die. Comatose person, unplug the machine. You hear that? Unplug the machine, they're going to die. It's not TV where the family's all around them. I mean, there is that in that situation when it's time to pull the plug. But that's when they're like, listen, this person should have healed from that. It's time to let them go. You see it in the States, but you have to pay for that. It's reality. I'm sorry, everybody. I've been to ICU with my daughter when she was very young, twice, because I'm sure one of those times I mixed up her injections. Thousands of times you administer injections. I think what happened is I reversed the numbers of the administration of her insulin, and I super shot her, put her to bed, and she went super low, beyond the point where I starved her body of energy to take for the cells, that she processed all the sugar in one shot and her brain immediately starved. And when they starve, what happens is when the body can't get any energy from sugar because you have no insulin, your body lights up all your fat cells on fire in the body, literally on fire. It's a combustion engine to release that energy for the cells, but you're toxifying the blood, you're literally poisoning the body, the organs will all shut down and they will die. The brain has no energy, they go into seizures, the body can't run anymore, and if it goes too long, they will never ever awake, or when they do, they will not be normal. And the one time that this happened, she'd been stroking out the night for a while. Obviously, it took me an extremely long time to bring her back. It took me an extremely long time, longer than it should have. Ambulance came, we were in the hospital, eyes go black, like somebody beat her badly, but it's diabetes. It took the life out of her. She was in ICU for 2 days. And I'm the parents, so I'm allowed to sit there, and then you see the whole unit, but I mean, they section you off, but that's it, and you're under watch all the time. I ain't walking around touching anybody or touching machines, and this is very limited, and that's in the juvenile, and you go to only one hospital for that. In the northern region, there's only one hospital that you can go for that. And rural Albertans got to all go for that particular problem as well too. Whether they can afford it or not, they have to find their own housing. They have to. People don't understand because they've never been through it. It's a very small amount of the population that actually has dealt with ICU. Very small amount. Very small amount. And those who've been through ICU and where they wake up and they're in a room and people come visit, that's after ICU. That's where they've made it out. Sorry, everybody. Same with COVID. You go in, you start out in one of those rooms. You start out there. But when you go to ICU, it's because you can't breathe on your own anymore. There's a tube in you and a machine artificially pumping air into you. Because if they take away the machine, you asphyxiate and die. It's truth. Reality. Would not give my dog this shit. Well, so don't, Rocky. But then at what point, when the numbers are so high, do the rest of us have to pay for you at $2,500 a day, or someone in your family or someone you care about? Because that's the reality that's happened in Alberta. The cost is astronomical, $2,500 a day. When do you say that I have to work, pay my taxes, and there may not be a bed for someone I love when they need ICU or you need ICU because somebody with COVID-19 has to have it? And it overwhelms the system. We just get more beds. That's the easy solution, right? We just up how much we spend on healthcare. Just keep upping it at incredible rates, way past the primary industry that can support it, because it already is for Alberta, way over what Alberta can support. Annual deficit, $22 billion for 4.3 million people. People got to wake up, get off the sauce. And these doctors telling you, it's stabbing, we're burning, and I get that, but they want to be funded more money. They want you to pump the system, hire more doctors, hire more staff, hire more. We can't run if you don't have the support in primary industry. Something else has to give. And we can't have lockdowns anymore. Something's got to give. And statistically, we have a give. And that's vaccination. Sorry. But the tremendous problem is those who are susceptible to COVID-19 flooding over into ICU. You can get COVID-19, maybe not even know it. Spread it to 6, 8, 10 people, one of which will end up in ICU. Just the way it goes. But at a rate massively more than any other influenza or the rest of it. Yeah, genocide of the unborn, blah, blah, blah. Crazy. Are the side effects of the vaccines outweigh the side effects of COVID? No, they don't, Justin. That's the other thing. Side effects of the vaccine do not outweigh COVID-19. Now, with billions of vaccines given to everybody, billions of them, there's been no billions of people with the COVID-19. There hasn't been no billions of people with COVID-19. The numbers there are way less. So people are going to say, oh, but look, out of 1 billion people, there were 12,000 vaccine injuries in this area, and then 16 more in there, and this many people died. Oh, look, COVID. You let COVID-19 unhinged rip through 1 billion people, and you're going to blow all those numbers right out of the water. You are more likely to have ill effects from COVID-19 than any vaccine. That's the stats now. Stats now. When you put COVID into that many billions of people, as administered by the drugs, you won't have a healthcare system. You'll be in big trouble. China, 1 billion people. You saw the earlies of China. They don't even have the vaccine rate, but they got so much restrictions. It's communism. They can implement massive restrictions, massive employer restrictions on the working class. People had immunity to the Spanish flu 80 years later, and science has proven already natural immunity is far better than vaccine for COVID. And if you're high risk category, you can take ivermectin or hydroxychloroquine. Now, please show me those stats in Canada. You're Canadian, I hope. Show me those stats and those tests in Canada on healthcare cards that prove what you say is valid. Oops. You don't got none of it. None of it. None of it. Nothing. Zero to back up those claims. In fact, the opposite in labs in Canada, in various provinces. No significant effect on COVID-19. Yep, fake. And, oh, that's poison. It kills everybody. Billions of vaccines. Billions. And look at Canada now. The stats of vaccine rollouts. Nothing anyone's saying has been remotely proven whatsoever. And the sad part with all of you in the minority is most people are now vaccinated in Canada and none of them are experiencing anything that you're talking about. There's none of those effects. Sorry. Like I said, I'm in an industry where everybody's forced to vaccinate. They got 2 weeks left. 2 weeks. So everybody's vaccinated. Most are vaccinated. The rest that don't, the minority, are going to be punted out of the job. And some foreigner will probably get it off the street. They'll train them up and pay them full rate. Guys go to school and a college to do. But that's what's going to happen. Tech can't be trusted right now. Stop your bullshit narratives. Okay, Rocky, I've asked for real, credible stats from Canada on anything you said, which none of it makes sense anyway. You're talking off the rails about babies dying and killing kids and blah, 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 which has nothing to do with the topic here, except for you don't want to vaccinate, probably religious, because it sounds like you're an extreme Christian. Where's your stats, man? They are lying. Okay, all the stats lying. Rocky sounds like Pat. Probably Ted. There's a lot of distractions. This Q&A, when you comment your opinion, Dave is skipping all the important... I'm not skipping. See, you're supposed to be able to scroll down. I'm getting so many messages. I don't know why it's doing that, but... Elections wasn't even. Who cares about elections? The whole feed is breaking up for me. I can barely even hear a full word. Irene Rempel says you're fortunate. Well, apparently the mass majority is fortunate too, Irene. That's the problem. The vast majority are fortunate with vaccines. Vast majority. Hundreds and hundreds. I don't know anybody, and I know these people personally. I work with them every day. Hundreds and hundreds. No ill effects. Tell you research Roman Empire and what they used to survive when they polluted their city with human waste. Okay, yeah. And they are not doing autopsies, okay. Heather Marchik, my doctor, told me it doesn't stop the Delta variant, doesn't stop you from getting COVID either. She said it appears to be safe, and it's the only teenage boys that are getting enlarged hearts. Oh, on and on. Listen, I don't know about enlarged hearts or people dying or the rest of it, because I don't see that in any stats. And again, we have billions of administered vaccines. Billions of them. I don't know anybody with any complications. My girl's got, my whole family's got, all my friends I know got it, because we're working class people. We need to work in our industries. We have to do it or we don't have a job anymore. And that's going to be a vast majority of Canadians. So, you know, people, I don't know, retired or you don't work, or I don't know where you've been, but anyone who works in any major industries, you get the vaccine and it's timed here. Then 2 weeks, some provinces, a month and a bit, others. Can't utilize any services if you don't. They're mandating it, and mass amounts of the population are doing it. And there's no major reports of people dying, or the same people are still around, and then they're looking at the fringe group going, wow, redonkulous. No magnetic arm, no testing of blood showing me anything weird in my blood, did all that too. I'm not disclosing my blood works on Facebook, but nothing that was said there is even remotely true. Nothing. It's silliness now. This in Canada also, I don't know, stories. I thought you were about how corrupt the government are. Just saying. Sure, politicians are corrupt. The first class citizen. Just saying. When do I talk about employees, third and second class Canadians, ever in a negative light? Are you really telling me, everybody, think about this, that you're going to get employees? I'm an employee every day of my life. Do you think an employer's going to go, Dave, we're not going to x-ray this joint. Who cares if it's chocked full of porosity? Don't worry about the product going through it, even though it could kill thousands of people in this particular area. What do you think my answer is? And even if, let's say it happened, how many people am I going to tell about that? In fact, let's just say they try to convince 1,000 welders just like myself to do that. How long until it's ratted out? 1 or 2 people? I wouldn't say no 1,000 employees and keep it a secret of indoctrination for months and months, years through a pandemic. Sorry, guys. People are good that way, especially the third class. You care. I know you do, and I know people work. People don't do things that compromise their morality to that level. There are a few individuals, sure, corrupt, greedy, seedy individuals, but you're not going to get past 1 or 2 people at that lower level income, the average Joe Jane income, to commit those kinds of crimes. They're going to tell you to get bent, especially against their fellow man. That's of the first class and usually over extreme wealth and power. Third class don't have extreme wealth and power. Yeah, Amanda, no need to mock anyone. Amanda, at a point, when people are losing their lives and it's right in front of you and the stats are real and it's verifiable, I have to call bullshit. I've always done that my whole life, and I can't take radicals with me. People who refuse to be honest, they can't come with me in this party. They can't even be a face of this party or interact with other people. Because going forward, PPC's going down the toilet. A lot of this radical idea is going to be going down the toilet. You can't have that in your party when it's a bold-faced lie. And that's what we're doing here today. I'm trying to get through people asking questions. Have you been paid off? I thought you were all about how corrupt the governments are. Just saying, yeah, we went through that. Have I been paid off? Have I been paid off? I'm in consumer debt proposal. I own a trailer. I'm at an extremely low wealth status. I am definitely a third-class Canadian. No, I've never been paid off. I've never taken a bribe. And everything I do and say is for each and every one of you. This is a hard truth, a pill you're all going to have to swallow. Real, credible stats. In my province, Alberta, where I was born and raised, people I care a tremendous amount, enough to try and remove them from an abusive Canada in 2019. Would I be here lying about my province, about the stats that are official in my province, just to be an asshole or for my own gain so I can lose a tremendous following and friends, which I go through this, just like Donald Trump, when push came to shove, when the truth needed to be said, I did the right thing and did the truth, which I always do. The stats show this narrative, that the narrative a lot of you are pumping is now completely false, proven beyond any doubt. Same stats John used, I'm using right now. Same stats. Verifiable, credible, and real. Alberta's in a bad way right now. A real bad way. They should investigate this in Canada also. I don't know what the Facebook is. Have you been... Yeah, we did that. Let's see. Half these goofy people need gray tape. Stop wasting your time, brother. You're right, Ted. I'm sending you a message, actual forms from the horse's mouth, Dave. Review it and then tell us what you think. Milos of Abel. I don't care about testimonies from people I can't substantiate. I'm not going to try to. I have real stats by Alberta registered healthcare numbers as they really are from start to finish in this period from July 1st to August 26th. I don't want to read in theirs or other countries or other words. I don't want to explore it. I'm working on a political party. I've taken this much time, too much time away from my proliferation, away from what I like. A lot of people have moved on from me, which is great. It's a last salvage attempt to save people from the pounding they're going to be getting in the months to come. And as you watch PPC get wiped out and the bullshit come forward, and then all these lunatics who you followed, you got suckered into it. It's a last-ditch effort to try and save people. And like I said, it's 8 minutes to 9. Wow. What do you know about the ventilators? Do they help or cause more damage to C-19 patients? In show, respirators are used for people who can no longer breathe on their own or in this process of dying because they're drowning in their own fluids. They use them because you're not able to breathe on your own. You're asphyxiating to death. Your lungs can't pump the air. That's why they use them. Steve Thomas, I hope you're going to watch your language. I try to, Steve, but it's a hot topic because it's Alberta. It's my province. And Albertans have died over this week. I was bamboozled. I hadn't looked at anything since July. And when I went through these stats, I was shocked and I became very angry. I'm sorry, everybody, but that's my home province. I have a tremendous heart for Alberta. And when my Albertans are dying or being lied to, and they're dying right now, or people in Alberta are dying when they shouldn't, I get pretty angry. Our local radio said schools need to consider it the same threat of going to school as smoking or bullying. Just saying. Okay. Think it's funny, your laughter turned to sorrows enough. Whatever, buddy. I don't even know why you're here anymore, but you're getting blocked after. ICU. Intensive care unit. Unchecked pneumonia will put you there. Been there. Not fun when you can't breathe. Thank you, Wendy. Thank you so much. God bless you. People don't know, Wendy. They just don't know. Oh, here we go, Lynn. They're in ICU because they're being denied proven effective treatments. I'm out. No more. You have turned out been bought. Ramble, ramble, ramble. Kaylin, show me your treatments. You are the one who deserves to get COVID-19 and go through this, not so many others. Really. Then let's put your money where your mouth is. Where's your ivermectin and all these great treatments? If they were there, people would be using them. We wouldn't have our ICUs like that. That's the truth. I'm sure there is, Douglas. Honestly, there is. But I think, too, isolation and everything else, natural medicines to help combat, and it will work for a lot of people. But it won't work for those susceptible to disease, as the stats clearly show. Just in Alberta alone, with no restrictions, no nothing in place, from July 1st to August 26th, we now see the tail of the tape that nobody can deny, nobody can say that's all fake. It's not fake. It's not fake. Just wondering sincerely, why would the government care about your health? They don't. Jason Kenney proved that. Andre, he didn't. He withheld the numbers as they continued to climb. In fact, he jumped on an airplane as the autocratic premier in full control of the government. McLean's NDP lied to you because they don't want you to know that part of it, how Jason Kenney makes all the autocratic decisions. And just like an election, it's like proroguing parliament. He is the crown autocrat who has full control of the lieutenant governor. He went on a holiday as numbers grew. If you haven't watched 660, which is Wild Rose News, the ultra-conservative party of Alberta, the best one ever that merged in with UCP, and we got Jason Kenney, a lunatic, who flew to Europe, fully open to Alberta with no experts, no nothing, no restrictions, no nothing. and it's completely exploded. It was exploding as early or end of July. The wild rosers go through all of this in great detail by the numbers. He watched it explode all the way through August. And you know what he said? Just keep going. Don't worry. I'll put on $100. People get vaccinated. It's going to change everything. No, it didn't. The numbers weren't there. And the numbers of ICU are there. And the number of infected are there. Run away, COVID-19. Well, Jason Kenney saw it escalate. He said, I'm going on holidays. It'll probably all be good by the time I get back from Europe. And he even mandated everybody, just ignore it. They have it all. His party wants him gone. You guys don't even know the insider yet. You don't even know all the inside yet. He is hated, beyond hated by the party. They want him gone. Jason Kenney's career is finished in politics. He's still trying to fight because he holds the crown. He's still trying to fight. No, he doesn't care about your health. He proved that. You're all going to get this disclosure as you watch. You're all going to get it. And even those who still don't want to believe it, don't matter. The mainstream is going to get it. And it's going to cause an NDP government, not an independence in Alberta, an NDP government. That's the polls right now. Fear-mongering BS, it's a cold, blah, blah, blah. Sandra again. Okay, no stats, no nothing. You don't like stats unless it goes for your narrative. More of the same radical BS. No stats. It's a pandemic. That may have been the case. A year ago, we could all believe on that. But the stats are in and Alberta's in. It's real. There ain't been no cold to do this kind of devastation to a system, a health system like Alberta's. Because there's a lot worse places in the world. Alberta's never seen nothing like what they just went through. Nothing. What they're going through right now. Never. Not since the Spanish flu. And Don says, Dave, I have a buddy, Dave. He's an airline pilot in China. He has no idea what you're talking about. Oh, well, he's an airline pilot in China. Are you saying about the J8? Maybe. But, you guys, Chinese didn't come up with the nickname J8. If that's what you're talking about, Don, J8 comes from an association of Australians and all Asian countries underneath China. China's a P5 who hate China, specifically Singapore. Chinese, Asian world, Southeast Asia is not all Chinese. Singapore, for example, an island country, the guy and those from that organization of Asian countries in Australia are saying I'm a dickhead, I'm a handicap, because they're using the J8. That's what it means there, because they don't like the Chinese. Because they're under the thumb of the Chinese. Okay, Canada denies access to them, so you won't find it. Access to what? Denies access to what, Jamie? I'm not sure. What about thousands of doctors saying this is BS? You were saying? You're thousands of doctors from where? Which thousands of doctors? I heard the Red Deer when I watched the video. And I already know Red Deer's deal. They don't even have a heart unit. That was a huge thing in the 2019 election. They don't have a cardiac unit. Not a functioning one. They definitely don't have any of the specialized ICUs that Calgary and Edmonton have. People don't go to Red Deer. They go to Edmonton or they go to Calgary. That's a fact. That's a fact on the extreme stuff. That's a fact. Very limited in Red Deer. Red Deer gets the shaft. Huge population, only 2 ridings. Government don't give 2 shits about Red Deer. I won't be putting stock into Red Deer. Sorry, guys. I just tell you the truth. Put your stock in Edmonton. Put your stock in Calgary from what those major municipalities tell you. Don says, why are you not reading any of my comments? I think I just did. I don't know. It's what scrolls when people type. What about those doctors claiming those in the hospital are vaxxed? Well, there are some one-vaccinated people there. In the 29, there are, I think, 2 one-shot vaccinated people in ICU of the period that died. I think 2 one-shot vaccinated people with complications, and then there's a bunch of COVID people with extreme complications, which was, I think, 7, and then there's 22 people who died on ventilators with COVID-19. No serious complications besides age. That's a fact. Unvaxxed. Which puts you back to the efficacy of 94%, guys. Sorry you just got the vax. Well, I've had the vax for months now. Close your borders, get this country's so-called virus under control, produce our own needs, wants not reliant. Now, just saying. Yeah, well said, Douglas. I like that. Canada denies access to them. I'm not sure. Sorry you got the vax. Perhaps you're trying to justify your choice. Wait till the flu season and your tune will change. I haven't been sick in 2 years. Not so much as a sore throat. I smoke heavy. I drink too. I've lived a pretty hard life. I don't know. I've been sick lots of times in my life, but this 2-year period, since initially 2020 January, as I've said lots of times, no, not so much as a sore throat, sniffles, none of it. Not really. Nothing. Nothing ever. No flu ever. Not one. Now I got vaxxed. I've had no complications. Nothing. Nothing. Both shots. Nothing. And we can go on, and everybody says, next time you get the flu, oh, see, it was your shot. Like, I've gone 2 years without the flu. Eventually I'll probably get it, or I'll get a sore throat, or I'll get something else, or maybe I'm going to get cancer. I blame that on the vaccine too, even though I've smoked lots. I've welded my whole life. I've worked in the dirtiest, grossest environments, in the dirtiest career you could ever take, in unhospitable IDLH environments, taking on, absorbing massive toxins, more so than any vaccine I've ever taken, just by my work. I've been knocked down at work for H2S, 100% benzene. They say it's pretty much over for me down the road at some point in my life. I'll get cancer. It'll be bad. Those are the statistics. People in my trade, in my particular trade, don't have an extremely long life expectancy. Historically, they don't. One of the lowest ones. Now, do you think it's right the government forcing everybody to take the vaccine at the expense of our constitutional rights to choice over what's best for the greater population? No, Justin, I don't. And I've never said that's a great thing. But the reality is this now. There's an extreme cost associated to healthcare if we do nothing and we let everybody run amok. Alberta just proved that those stats are in now. Now all of a sudden, vaccine cost versus the damage of doing nothing is extremely expensive. Who's going to pay for that? Do I got to go to work every day and keep paying for a healthcare system nobody can afford? And worse, other things like cancer, heart, all these other things that have high death rates, high suffrage, go untreated. We're going to be in lockdowns, masks. I'm sick of wearing masks. Reality is COVID wasn't going to get me. Not at this age of my life anyway, in this condition of my life. But the system's being drained by this disease for a percentage of the older population generally. The statistics are higher, but it does go down into ages where normally that shouldn't be. So, what do? Ignore it and pay the bill? I don't want to ignore it and pay the bill, wear a mask, restrict businesses. If the vaccine has this efficacy and it's going to reduce that to a point we don't have any lockdowns or whatever, I'm not saying forced vaccine. I get it. But at some point, we all got to make a decision. I say constitutionalism, and we the people write that in, and we control the government going forward. But there are vaccines we've all had from birth, no one bitches about, because you don't want those diseases coming back. All I know is I don't want my healthcare system overrun. I don't want to wear a mask anymore, and my government's making me and everybody else do it for employment or to use services. So at what point, when we look at Alberta stats, do we say, do it, it's the right choice to do if it gets us out of this? But if it's not, no masks, I don't know what to tell you, but I don't want to pay for it anymore. And I don't want to live in this kind of world. That's my answer. At what right does anybody have to take all my hard-earned money to pay for somebody's right for something? How much is that to cost me? I gave up my rights on the vaccination early. At what point do I have to pay for your rights, right? You know what I'm saying? Have your right, but at no threat, harm, or expense to anybody else. And now it's becoming clear in the majority, vaccines haven't really hurt anybody. Not like everyone's saying. And at what point do we say unvaccinated people are costing a shitload of money now? In fact, other deaths are associated with it. That's what I believe. Funny thing is, people are speaking out. You aren't listening, and they are being silenced. Judicial Watch, Project Veritas. I don't want to hear any more about Project Veritas and other Judicial Watch arrests. I don't anymore, you guys. I just worry about my country and the problems of Canada. We have to stop going out and outsourcing for other problems. That's the mark of people who don't want to deal with the problems right in front of them. They want to run away into fantasy on somebody else's narrative, on some other country, somewhere else, that is nothing even remotely close to your country. Not even close. Where can I find the evidence of someone being asymptomatic carrier without symptoms? It's kind of tough, Douglas. There's lots of children that are asymptomatic, and even adults. There's athletes. There was an athlete who was at the end, a basketball player, tested positive on the road, and he was already 12 days through it, and he had played the ball game the day before, and he did well. Didn't even know he was sick. He's like, I kind of had a headache, you know. Like it's kind of what evidence. That's the thing for people. It's individual, and for a large amount of the population, it's not affecting us. But we're seeing it in ICUs and treatment in our hospitals. We're seeing that when unregulated. For a portion of the population, much, much, much larger than influenza ever was. And Alberta just proved that by an extremely large margin. That data cannot be dismissed. I can't dismiss it. I have to tell you the truth, because I've promised to tell you all the truth, no matter what. Popular or not. And I've lost tremendous on this. Tremendous. 500 people, outstanding friend requests, gone. I don't even know the damage to followers. Gone through it worse than this before. And I eat it. It sucks. Takes a lot of energy and time out of you. It's kind of put me off on my proliferation. I have an email to go out to the UN tonight. It's after 9 now. I have very limited time. I have to be up at 3:45 tomorrow to drive 2 hours to my job that starts at 6 a.m. I get to do the 9:05 run, the 4:01, right through the whole GTA. You all got to see during the election, that map, that run. I start over here, go run through the GTA, all the red, all the way around to Aaron O'Toole's riding. That's where I go every day. 2 hours each way. Everybody's saying thanks. Independency Hospital. Brenda says thank you. Thanks, Brenda. Let's see. Yeah, Mike has some relative people just talking. Just looking for comments. There's lots. You need questions direct. I don't know. Why is there such an uprising in Canadians against the jab? Many people I know are having severe complications after shot 2. Just saying. I don't know any. Again, hundreds and hundreds of them. I know none. All kinds of family members, none. And I shouldn't speak of particulars because it's not right. But none. And we're talking old people here. None whatsoever. I don't know what to tell y'all. Lived it. Family lived it. I don't know what to say. Our hospitals promoting natural remedies to aid pandemic, like vitamins, C, zinc. Everybody promotes all those things aside of they're not going to save you from COVID-19. Your immune system's going to respond to COVID-19 as it's destined to. For a massive portion of the population, it's not going to affect you, but it's going to affect particular portions of the population and add to the strain of our system. We can't afford it. That's reality. Alberta proves it. Thanks for answering. No problem, Justin. I'm 65 and no adverse effects to the shot. Thanks for sharing that, Mark O'Reilly. Exactly. You're not alone. I know hundreds and hundreds of you. They're not going to speak up here because people want to keep that private. I always put myself out there. That's the politician way. You want to be a big boy. You want to lead. You get out there. You stand for what you have to stand for, which for me is truth. Which is truth. This is truth. Okay, so you gave up your rights. So alcoholics, fast drivers, and the rest of stunt people don't get any medical treatment. That's the whole point about what we're talking about here is no, they don't get any treatment because COVID has outweighed everybody. They used to get treatment, no problem. But it's not just them. You could be a healthy guy who likes riding a 10-speed bike. He ain't getting medical treatment either. They were advertising this in Alberta. Miloslav. That's what they were advertising in Alberta. They put it out there 2 weeks ago. Don't do any extreme sports. Don't do this because if you have a major accident and require ICU, we will not be able to guarantee you we can treat you. That's for 2 weeks of Alberta. Advertising. Putting out ads like that. That's what the health sector's been putting out. Fact. Michelle says they say this is not a vaccine, it's a gene therapy. If you look at Israel and Australia, vaccines not brought things back to normal. No on a variant, they haven't, but they don't have the vaccine rates. They don't. Neither of them did. And I wouldn't trust on Israel all too wholeheartedly as we have Palestine and Israel. Those are not countries I go for. Australia, another country, crown colonial, just like Canada. I worry about my country and the stats I can verify. I can't verify Australia. They have a vaccination rate, not a great one. They're not topping any charts. Just like Alberta didn't top any charts at 38.3% when they opened everything wide open. I am sorry. Ontario has some great stats. Whoa, we can't look at those. 89% double vaccination rate. Ontario's extremely high and densely populated. Densely densely populated, as you should all know. I know, I see it. I've been touring it for 6 months now. You know, from a guy from Alberta, going through all these big cities, and they don't have the same problems Alberta's got. Way higher vaccination rate, kept into restrictions, all kinds of stuff they followed. Way less numbers, extremely less, and tremendously more population and extremely denser and bigger and larger and many more municipalities. The stats are undeniable. A Delta variant sweeps through, gets through everybody. These things may happen, but what is the double vaccine rate? That's the issue. That's the issue. That's the issue. These Alberta stats are going to run through the world, and it's going to make people think. Okay, our governments have given more money away to others for whatever. Why borrow that and not help our own country first? Now superimpose people of Canada on health costs. Just saying. Well said, Douglas Ben. You're making an argument that doesn't work. Even with 100% vaccine, you'd still get and pass on COVID in reality. So what sense? The sense is vaccines clearly reduce the amount of how many people go to ICU. It's not going to stop you from getting COVID, but it is going to limit you at 94%. That had you not had a vaccine, you are 94% less likely to end up in ICU. 94% less likely to end up in the hospital. 94% is a heck of a lot better than 100% that you could. And the stats show that. Just in Alberta, when you take away all restrictions, masking fully open, in 3 months, the stats are there at a 38.3% double vaccine rate. It's a world stat now, and a lot of people are going to be running that. What kind of leader would be that crazy to gamble like that with citizens' lives? Well, Jason Kenney is. Look what he did with the pipeline. Look what he does with their thing. It's called autocracy. Other governments aren't allowed to do that according to their constitutions. Jason Kenney doesn't have a constitution. He is an unrestricted free agent for as long as he sits in majority. He gets to decide to do whatever he wants, and nobody can.